you very, very much. Thank you, Susan, for those words. W.C. Fields said, never follow kids, animal acts, or Biff naked and Fred Lee. First of all, I have to say thank you, and that this is really a great honor, although also very embarrassing. Standing up in front of 500 people who've just seen your baby pictures isn't easy. I want to thank a number of persons who've put a lot of work into putting on this amazing evening. And do not fear, this won't be an Academy Awards speech. First of all, I want to sincerely thank Susan Mendelson. No mere thank you is enough. Susan has worked incredibly hard. Susan has really worked incredibly hard to put her magic and energy into this event, and it really shows. I also want to thank the entire volunteer committee who are listed in the program. Toda Rabba Gadola to Dina Wachtel for all her efforts. I had a great time visiting Hebrew U. With Dina in January, and I know I will continue to work with her on establishing the collaborations. I want to thank the board of the Canadian Friends of Hebrew University, and especially Phil Switzer, for their passion for this cause. I thank the BC Cancer Foundation who supported this event, and in particular, Kirsten, Sharon, Doug, and Brendan. And I want to thank Dr. Gabbro for emceeing. She's done so many of these, she deserves her honorary MD. Biff for being the amazing, generous soul that she is. Brooke for eloquently sharing her story. Fred for his ever-present energy. Sarah for her words, and Corey for forcing me to do the video. I hate pictures. These are many of the people who put it together, but there are others, including Kevin, Tom, Deborah, Esther, and too many others to list. And my family and friends for being there while I obsessed. And I have to thank all of you who've shown support for this cause by attending this dinner, including a number of out-of-town guests, to use a familiar phrase, including Stephen from Saskatoon, Alvin, Dennis and Nancy, Cheryl, and others who I'm probably forgetting right now. So the hockey game or the dinner, what a choice. Both could possibly be seen as masochistic. I really have to thank you for supporting. We've all been touched by cancer, either ourselves, our family, our friends, and cancer is not just about the individual, so thank you for supporting this. I am getting honored at this event, but I do not work in isolation. I work in a community with many very talented and committed clinicians and scientists. This includes oncologists, surgeons, radiologists, pathologists, GPs, nurses, far too many to name. These people work at the BC Cancer Agency and in the larger community, and by honoring me, you are also honoring their work. We are all trying to achieve the same goal. Finally, there are their patients, their families, and their friends who constantly teach us, who continue to challenge us to do better. As Brooke said, she certainly did not choose her cancer, but she wants to be a better me. We all want to be better in terms of what we can achieve. Although since I began training to be an oncologist, we've made significant improvements in the survival of many cancers and a 30% improvement in the survival of breast cancer, we still have a long, long way to go. And standing here, I'm reminded both of those persons who've done well, and I hope continue to do well, and those persons who have died of their cancer, who stimulate us to continue to try to improve our treatments. It is the true stories, the stories we hear daily, that challenge our humanity, our hearts, our minds, and our resources. Although this event is promoting breast cancer research, it's important to know that discoveries we make in breast cancer inform us about other malignancies, just as work that is done in other cancers teach us about breast cancer. Thus, by supporting this dinner, you are also supporting cancer research in general. As we discover more about the genes that are the drivers or engines of cancer growth, we discover that many genes are shared by a number of malignancies. Therefore, learning about those genes helps us improve our overall understanding. A cancer is given a name by virtue of where it begins. For example, the breast or the prostate, the lung or the colon. But what is essential to a cancer are its characteristics, and this is related to the genetic makeup of the cancer. Learning about these characteristics will lead to better treatments and better survival. Learning what is specific to breast cancer will be critical to curing more breast cancers. Breast cancer is not a new disease. There's evidence of breast cancer in the ancient world. Some of the inherited genes that cause an increased risk of getting breast cancer, the BRCA genes, have likely been around since the destruction of the temple and the expulsion to Babylon in 586 BCE. There are famous paintings that show breast cancer. By Rembrandt, we can see breast changes in Bathsheba by the bath. La Fornarino by Raphael is the most famous portrait to show a breast malignancy. And a recent new find of a lost painting by Leonardo da Vinci shows a woman with an obvious locally advanced cancer reaching out for healing. People are still reaching out for healing. When I started training in internal medicine and oncology, a long time ago, as you heard from Susan, and Larry Goldenberg and Paula Gordon know just how long ago that was as we all started out our residencies together, we spoke about breast cancer either as premenopausal or postmenopausal. We talked about women older than 50 or younger than 50. Hormone sensitivity, which had been first discovered in the mid-19th century, was really our only good classifier. Over the years, we recognized that breast cancer was not one disease, but we began to describe 4 main types of cancer. But as you've read in the paper this week, that notion is now out of date. My colleague, Sam Aparicio, who you saw in the video, in collaboration with a number of people in BC and internationally, has published groundbreaking research that breast cancer is not 4 diseases, but at least 10. We're getting into a minion, that magic 10 number, but it's likely that there are even more groups to be discovered. So why are we finally suddenly discovering new types of cancer, and how is this going to improve our ability to treat and detect cancer? You've heard that both the group here and the scientists at Hebrew U are working in both the genomic code and the epigenetics of cancer through next-generation sequencing. And what does that mean? One metaphor we can use is to think of cancer as a book, or a Kindle if you'd rather a Kindle. In our standard practice, when we see a new patient with cancer today, we look at the cover of the book, and we attribute various characteristics to that cancer based on what the cover looks like. Is it a breast cancer that is sensitive to hormones or not? Is it a cancer that's aggressive or not? These attributes may be similar to asking whether the book is a romance or a thriller. With new techniques that Sam and others are pioneering, they can now decipher the letters that make up that book. And suddenly we're able to know more about the book. Seeing the letters in the book is the next generation deep sequencing of the DNA. But the letters may have variations in how something's phrased, which changes the meaning completely. And these variations make up the different types of cancer. The problem is, the book's not just made up of letters. It's made up of words, paragraphs, and chapters. And this is an area we still do not understand. How those words are construed is similar to a new area of research called epigenetics. Epigenetics can be thought about as how the cancers reacted to the environment, or maybe how the author has structured the plot of the story. One of the top researchers at Hebrew University, who you saw in the video, is the scientist Howard or Chaim Cedar, who was just awarded the prestigious Gardner Award, Canada's top scientific award, and who many believe deserves a Nobel Prize for his pioneering work in epigenetics. For many of us, his scientific achievements are what we're in awe of. For others, it may be that he's the father of Joseph Cedar, the director who's made a number of award-winning films, including Footnote, which was just on at the Fifth Avenue Cinema. For others still, his claim to fame may be that his mother was from Winnipeg. In the video you just watched, Howard and I are playing that wonderful game of Jewish geography. But back to science. Through genetic sequencing, we can now decipher the letters. We have some scientific knowledge about the words, But the challenge that faces researchers and oncologists around the world is that we do not yet know how to read the book for the patient who's sitting in front of us. Continuing on this metaphor, we're also learning that the book is more like a manuscript, changing along the way, being edited continually, a bit like Wikipedia. And this is both an enormous challenge and an opportunity. We may be able to change the story from a tragedy to a good news story if we can develop and direct treatments at the manuscript to make it a curable cancer. We may be able to earlier detect cancers if we understand how these genetic manuscripts first get written, and if we could detect them before they became a fixed text. So what do we need to do? We need to take our basic science technology and study large numbers of patients to begin to understand how to treat patients in an individual, personalized manner, and that is what we plan to do. Going from the cover to the letters has taken great scientific minds. Going from the letters to the chapters and understanding how we can develop new treatments for each patient will take time and the collaboration between scientists, oncologists, surgeons, radiologists, and patients. What is also not usually appreciated is that at Hebrew U and at IMRIC, there are senior scientists working together who are Israeli and Palestinian, who are Jewish, Christian, Muslim, and any other religion or not. Fostering scientific collaboration and enabling the promotion of their work is something I'm very, very proud to be part of. In 1998, my family and I spent 3 months in Israel, and through working in an oncology department in Jerusalem and lecturing around the country, I established some very close relationships with the oncology community. Now, through this effort, I also have contacts with scientists at Hebrew U, many of whom are talented and creative. But there are limitations in their ability to access research fund and clinical data. We can make a difference to their success. Although we would all like to talk about one simple cure for cancer and one way to prevent cancer, there's not going to be one quick fix. But by doing the collaborative work that we're doing to understand the individual codes of cancer, we can further understand how to better treat these cancers, how to better detect cancers earlier, how to determine who may be at high risk, and ultimately, we hope, how to lead to more cures. We can begin to improve survivorship. If we go back to this book analogy, at this time, some of our cancer books have happy endings, but too many still are tragedies. We want to increase the number of happy stories we can tell about cancer. Regina Jonas was officially ordained as a rabbi in Berlin in 1935, the first woman to achieve that status. She died in Auschwitz in 1944. Her writings were found in 1992 and include this quote, which I think is very relevant for tonight. Whoever dedicates their lives to others must not only comfort with words, but through deeds. Thank you again very much for the deed you have done tonight by supporting this collaboration and this event, and very much for this honor. Thank you.